What if the government just paid for a robot to live in your home, cook your food, clean your floors, and stay up while you sleep? Sounds like something out of a science fiction, right? But this is actually a real conversation happening right now. Tesla's Optimus robot is coming in at $20,000 to $30,000, and people in Washington are already asking whether seniors on Social Security should get it subsidized or even free. Today we are going to talk about whether that could actually happen, what this robot can really do, and what nobody is saying out loud. Stay with us because it gets really interesting from this point. The care crisis nobody wants to talk about. Let's start with something most people do not fully realize until it hits their own family. Senior care in America is in a really bad place right now. Not bad like it needs a few improvements. Bad like the whole system is cracking under the weight of what is coming. A private room in a nursing home now costs an average of $10,978 a month. That is over $130,000 a year per person. And that number goes up every single year. For most families, that is just not possible. So they try to keep mom or dad at home. Makes sense, right? But hiring a full-time home care aide at around $35 an hour works out to about $80,000 a year. Still not affordable for most people on a fixed income. So what happens then? Family members step in. And we mean step in hard. Quit jobs. Rearrange their whole lives. Run themselves into the ground. Right now, 63 million Americans are doing unpaid caregiving for an elderly relative. That is 1 in 4 adults in the country. And here is the part that makes all of this so much worse. America is heading toward a shortfall of 4.6 million unfilled home care jobs by 2032. That's not a small gap, or something you fix by raising wages a little. 4.6 million people who are simply not going to be there to do this work. And while that is happening, 10,000 baby boomers are turning 65 every single day until 2030. Think about that for a second. More seniors, fewer workers, costs going up. And families are already exhausted. This is the situation lawmakers are staring at. And that is why, as wild as it sounds, a robot is starting to look like a serious answer to some of them. Because when you run out of normal solutions, you start looking at the ones that used to sound crazy. What Optimus does and why Washington wants it. Okay, let's talk about Optimus. Because we think a lot of people have seen the clips and either thought it was impressive or thought it looked like a very expensive trip hazard. That is a fair reaction, honestly. Here is what the specs actually say. Optimus stands 5'8", weighs around 125 pounds, and can carry up to 44 pounds. It runs on the same AI system behind Tesla's self-driving cars, so it uses cameras and sensors to read the environment and move around without knocking everything over. The hands on the latest version have 22 degrees of freedom, which is close to what a human hand can do. It handled eggs in one demo without breaking them, which honestly is more than some people can say. Tasks it has actually been shown doing are folding laundry, vacuuming, sweeping, wiping tables, stirring pots, opening cabinets, pouring drinks, taking out trash, and watering plants. For someone elderly living alone, that list covers a significant chunk of what daily life requires. And it gets software updates over the air like a Tesla car, so it keeps improving without you doing anything. Now, here is the part the press releases leave out. At Tesla's We Robot event in late 2024, some of what people saw on stage was Teleoperation, a human controlling the robot remotely, not full autonomy. And Elon Musk himself said in January 2026 that current units are primarily for learning, not productive tasks. So the robot is real, it is getting better, but it is not ready to be left alone in your grandmother's apartment yet. Experts put certified elderly care deployment somewhere between 2028 and 2030, which still might sound far away until you realize that is roughly the same timeline as when the care shortage is expected to fully hit. Nobody in the government has come out and said we are buying robots for seniors. Let's be clear about that. But the economic case for it is hard to ignore, and that is what is driving the conversation behind the scenes. Medicaid is currently the single largest payer for nursing home care in America. It is spending well over $100,000 a year per person to keep elderly Americans in facilities. Now imagine instead of that, the government spends $25,000 on a robot and lets a qualifying senior stay in their own home. That $25,000 pays for itself in under 3 months. And after that, the government is saving nearly $100,000 a year for every person who does not need a nursing home bed. The structure for this kind of program already exists. Medicare already subsidizes medical equipment like wheelchairs and hospital beds. Most states even have Medicaid waivers that pay for in-home care instead of nursing home placement. So a robot subsidy would not need a brand new system built from scratch. It could simply plug into what is already there. And with Musk confirming that Tesla plans to offer Optimus on a rental basis before direct sales even begin, the entry point gets even lower. If a subsidized monthly rental for a qualifying senior came in at a couple $100s, that is less than what one day in a nursing home costs, less than a few hours of a paid home aid. The math is so one-sided it practically makes the argument for you. So the only real question is whether the people in charge move before the crisis gets worse or after. Right now, there is no official bill, no announced pilot, no agency program. But what there is serious economic interest. And that kind of interest has a habit of quietly becoming policy over time, especially when the alternative is doing nothing while the numbers keep climbing every year. What would this actually cost you? Let's get practical and say a program does happen. What does that actually look like for someone on Social Security? The maximum SSI payment right now is about $994 a month. Not a lot, but a subsidy program would not ask a senior to pay full price. It could work like a grant or a low-cost lease. And since Musk already confirmed Tesla will offer rental options, a subsidized monthly rental for qualifying seniors could land somewhere between $200 and $300. That is cheaper than 2 hours of a paid home aid per week. Most people on Social Security could manage that. Or think about it like the wheelchair model. You do not pay full price for a Medicare-covered wheelchair. You pay a copay, sometimes nothing, and the program covers the rest. A robot program could work exactly the same way. And what does the senior actually get out of it? Something that does not call in sick on a Tuesday. Something that does not need breaks or overtime. Something present in the house at 2 a.m. when your 82-year-old mother gets up and is not steady on her feet. It is not going to replace someone who loves her. But for someone living completely alone with no family nearby, it is a completely different situation compared to nothing. Because that is the real comparison. Not a robot versus a caregiver, but a robot versus nobody showing up at all. The things people are right to worry about, and the honest timeline. Look, we are not going to sit here and tell you this is all great with no problems. There are real concerns here, and they deserve a straight answer. The most obvious one is safety. A 125-pound machine walking around a frail person who might weigh 100 pounds cannot make mistakes. Falls are already the leading cause of injury-related death in adults over 65. One bad misjudgment and this whole conversation changes fast. Tesla's robots do have collision detection and force sensors, but the safety standard for operating around vulnerable people is extremely high, and regulators are going to want a lot of evidence before anyone signs off on putting one of these in a senior's home. Then there is the loneliness question, and honestly, this one bothers us more than the safety question. Loneliness is one of the biggest health risks for older adults. A robot that folds your laundry and stirs your soup cannot actually sit with you, cannot notice when you seem off today, cannot call your daughter because something felt wrong. There is a version of this where an elderly person gets a clean house and still feels completely alone. That would not be a success. And then there is access. Technology subsidies in America have a track record of reaching people with advantages first. If a robot program ends up serving seniors in well-connected cities and leaves rural and low-income families behind, that is a problem that has to be designed around from day one, not patched up later. None of this means do not do it. It just means do it carefully, do it equitably, and do not pretend the hard questions have easy answers. Now, let's not pretend things are moving faster than they are. Right now, in June 2026, you cannot buy an Optimus. It is not on sale to anyone outside Tesla. Limited commercial sales to business customers are targeted for late 2026. Public consumer sales are aimed for the end of 2027, according to Tesla's latest investor updates. But Tesla has a well-documented history of announcing dates and then missing them. Most analysts expect widespread consumer availability closer to 2028 or 2029. A government subsidy program would need Congress or an existing agency like CMS to act. And even if the discussions are already serious, nothing real happens before 2028. More likely 2029 or later for any meaningful rollout. So if you are watching this hoping there is something you can do for a parent right now, this is not that. We wish it were. But the honest answer is that this is still a few years away from being real. What is not a few years away is the care crisis it is meant to solve. That one is already here. Now, for context on the price. Industrial-grade humanoid robots, the kind built by companies like Boston Dynamics or Agility Robotics, easily cost anywhere from $150,000 to $250,000. Even the earliest enterprise test units from tech startups regularly top $100,000. So, if Tesla can actually deliver Optimus at a mass market price of $20,000 to $30,000, it changes the entire math. It puts a humanoid robot in a completely different category. And if Tesla actually delivers that price at scale, the argument for subsidizing it for elderly Americans becomes genuinely difficult to dismiss. The government saves money, seniors stay home longer. Families get some relief. The math works. The technology is getting there. The only thing left is whether the political will show up in time. Because when you put a $30,000 robot that cooks, cleans, and never sleeps against $130,000 a year in a nursing home, the argument almost makes itself. Whether Washington figures that out before the crisis peaks is the part we cannot answer yet. Now we genuinely want to know what you think. If the government subsidized one of these for your parents or grandparents, would you say yes? Or is there something about having a machine in that role that sits wrong with you? Because both answers are valid and we want to hear them. Drop it in the comments. And if someone came to mind while you were watching this, send this to them. Hit like, subscribe, and we will see you in the next one.